In this video, we'll discuss about blood disorder. What is blood disorders? It is a group of illness that affect the red blood cell, white blood cells, platelets, or the protein involved in clotting. So it is a group of illness affected RBC, WBC, and platelet. Then common blood disorders. Now we will discuss that common blood disorders: anemia, thrombocytopenia, hemophilia, one Willebrand disease, and sickle cell anemia. So these are the 5 important things causes blood disorders. So we will discuss one by one in detail. First one is anemia. What is anemia? Anemia is a condition in which body does not have enough healthy RBC to carry oxygen to all its tissue. So our body does not have enough healthy RBC to carry oxygen. So this condition name is called anemia. Then what are the things causes anemia? It can be causes due to variety of factor: nutritional deficiency, chronic diseases, excessive bleeding, and medication inherited disorders. So nutritional deficiency, chronic diseases, excessive bleeding, medication, and inherited disorders will causes anemia. Next, what are the risk factors? Age, pregnancy, and sudden medical condition. Then what are the symptoms causes this anemia? Fatigue, pale skin, chest pain, shortness of breath, dizziness, and headache. So these are the symptoms: fatigue, pale skin, chest pain, shortness of breath, dizziness, and headache. Then diagnosis method: we can diagnose this anemic condition by using physical examination and blood test. Then treatment purpose: taking iron supplement, then eating a diet rich in iron, then receiving a blood transfusion. Anemia: our body does not have enough healthy RBC. Then causes: nutritional deficiency, excessive bleeding, medication, and inherited disorders. Risk factors, symptoms, diagnosis: we are using blood test and physical examination. Then treatment: we will take iron rich supplement, iron rich food we will take. Then preventive method of anemia: maintaining healthy diet, taking vitamin supplement, and avoid some kind of medication. So healthy diet, vitamin supplement, avoid sudden medication. Second condition name is called thermocytopenia. Thermocytopenia is a condition in which abnormally low level of platelets in bloodstream. Abnormally low level of platelet in bloodstream. Platelets are small cells that help the blood to clot. Any case of injury, when we have injury by using platelet only, that clotting process will occur. Here thrombocytopenia, abnormally low level of platelet. Anemia doesn't have enough amount of healthy RBC. Here low level of platelet in bloodstream. Causes of thermocytopenia: some autoimmune disorder, viral infection, and uses of sudden medication. Autoimmune disorder, viral infection, and some medication will causes thermocytopenia. Risk factor: age, gender, family history, and lifestyle habit. So it can be due to various factors, mainly age, gender, family history, and lifestyle habits. Symptoms: easy bruising, rashes, and fatigue. Diagnosis method: we can collect blood sample to measure platelet count. treatment, medication, lifestyle changes, and stem cell therapy. So, second condition name is called as thermocytopenia, abnormally low level of platelet in bloodstream, then causes autoimmune disorder, viral infection using of some medication. Symptoms: easy bruising, rashes and fatigue. Diagnosis: blood test used to measure that platelet count. Treatment, medication, lifestyle changes and stem cell therapy. Third condition name is called hemophilia. This one is the rare genetic disorder. Hemophilia is a rare genetic disorder caused by a missing or defective gene. So it is a rare genetic disorder caused by missing or defective gene. Inability of that blood to clot properly, leading to excessive bleeding. Risk factor: family history of the disorder and known genetic mutation. Then symptoms: prolonged bleeding from cut or trauma, easy bruising, then frequent nose bleed. Diagnosis: physical examination, then medical history and genetic testing. Then treatment: replacement therapy, medication to help control bleeding and lifestyle changes. Preventive method: genetic counseling and lifestyle changes. So third condition name is called hemophilia. It is a rare genetic disorder caused by missing or defective gene. So risk factor: because of family history and genetic mutation. Symptoms: prolonged bleeding from cut or trauma, then easy bruising and frequent nose bleed. Diagnosis method: physical examination, medical history and genetic testing. Fourth important bleeding disorder, von Willebrand disease. It is a genetic disorder. So it is a hereditary bleeding disorder that affected both sexes. It caused by deficiency or dysfunctions of blood protein called von Willebrand factors. So it caused by deficiency or dysfunctions of blood protein name is called von Willebrand factor. This protein help the blood to clot properly and is responsible for normal platelet aggregation, addition and aggregation. So risk factor: family history, old age, sudden medication, diabetes and kidney failure. Symptoms: excessive nosebleed, easy and excessive bruising, heavy menstruational bleeding in women and prolonged bleeding after dental work, surgery and childbirth. So these are the symptoms: excessive nosebleed, then easy and excessive bruising, heavy menstruational bleeding, prolonged bleeding after dental work, surgery and childbirth. Diagnosis: this VWF antigen test. Diagnosis: Van Willebrand antigen test, Van Willebrand collagen binding test, Van Willebrand restosedine cofactor test. So what are the tests we can use? Van Willebrand antigen test, Van Willebrand collagen binding test, Van Willebrand restosedine cofactor test. Then treatment: replacement therapy, desmopressin acetate, then anti-fibrolytic drugs we can use. Final one is single cell anemia. It is also genetic disorder that affect RBC leading to anemia. So single cell anemia, it is a genetic disorder that affect RBC. So leading to anemia caused by mutation of the gene for hemoglobin protein that carries oxygen throughout the body. Symptoms: anemia, jaundice, fatigue, pain, organ damage and infection. Diagnosis purpose: using blood test. Treatment: pain management, antibiotic, blood transfusion, stem cell therapy. Preventive method: genetic testing, avoid sudden infection, then taking folic acid supplement. So in this video we discussed the blood disorders, 5 important disorder: anemia, thrombocytopenia, hemophilia, van Willebrand disease, single cell anemia. All the things: causes, risk factors, symptoms, diagnosis, treatment and preventive method we discussed. So this one, third one is hemophilia. Fourth one is van Willebrand disease. Then last one is single cell anemia. Thanks for watching.